I want to start by saying that unfortunately, at several times during this pandemic, people who are vulnerable, people who are blood cancer patients may have felt at a broader societal level a bit left aside, not considered. And I think all of us who work in blood cancer or with people who have serious illnesses have felt, I certainly have felt frustrated about that. Um, we all want to be understood by people. We all want people to respect us. That's a basic human desire. Unfortunately, it's not in my control what somebody else understands or respects. What I can control is my choices, what I say to other people, and what I choose to do or not do. Um, I suspect that for most of us, we have relationships, social relationships, which are in different layers. So, at the very first layer is myself, and people really close to me, like close family members, close friends, people I'm very intimate with. With something like blood cancer, it might even be your professional clinical team who's looking after you, your nurses or your doctors. And then there might be people who are a bit more distant. There might be acquaintances, work colleagues, friends who are not that close, neighbors, people like that. And at the very edges of the periphery are just complete strangers who you might encounter. Now, I share this because knowing this will influence, firstly, how important it is to us that somebody understands where we're coming from, and also how much effort and time we're willing to put in order to make sure that any misunderstandings are actually resolved. I said at the start that we can't control what somebody else thinks or does, but we can control and get better at practicing how to be assertive about our right to do what we need to do to stay safe without feeling ashamed or embarrassed about that. Things can get in the way of that assertiveness are if we've experienced sort of social traumas in the past, or if we've experienced a lot of rejection. People who suffer from low self-esteem or low self-confidence struggle to be assertive. Or it might be that somebody with a blood cancer diagnosis might feel a little bit tired of feeling different from other people anyway, and this just adds another layer of difference on top of that. And these emotions are all valid. And I just want to say that it's not embarrassing or stupid to feel upset when somebody doesn't understand you or makes a hurtful or insensitive remark. We're social beings and we would all feel like that. It's built into us to want to be understood by people around us, even if they don't actually matter that much in our day-to-day life. So processing this can be helpful. It can be helpful to even speak to somebody like myself or another professional to understand, why do I react like this when somebody doesn't understand me? But then what we want to do is to set boundaries clearly. And how you do this will vary depending on your relationship with the person who's not understood you or not respected you. Using phrases like, I'm just not comfortable doing that yet, or my doctor's advised me that I probably shouldn't do that yet, or my immune system is compromised. So give a simple explanation for your choice, without apologizing for it. If you face pressure or lack of understanding, and sadly, if it's coming from somebody very close to you, this can be really painful. What I might suggest then is to explain to the person how it makes you feel that they are not understanding. I might use a phrase like, it hurts me that you don't seem to be able to understand why this is important to me, or why this is where I'm at with this right now, and that you're not able to accept that and support me with it. If you're genuinely feeling bad that you're not able to go to an important event like a birthday or a wedding, it's okay to acknowledge that and say, I would really want to be there, and let's try and do something afterwards to mark this occasion. If it's somebody a bit more distant, and maybe they're just unaware, then it might be sufficient to just say, actually, even though I've been vaccinated, we're not sure how effective the vaccine is, so I'm just being a little bit careful. And their lack of understanding, if that's the issue, then they should get it, and they might be respectful of your choices after that. Then, of course, there are situations where your best choice is to politely walk away, rather than argue the validity of your point. And these are situations where, it's not lack of understanding that's the issue, it's lack of respect. And unfortunately, what this pandemic has shown is that while there are a lot of people who are caring and considerate, there are a proportion of people who are not. And I think we are good at judging where it's gone from. Actually, I can explain it as much as I want to, but I don't think this person is going to understand. I think we have a radar for that. So when it's reached that point, you could say something like, I don't feel it's useful to argue about what's the right thing here. How about I do what's right for me and you do what's right for you? Sometimes that is the most helpful option. Naturally, in a public place like a supermarket, we can't get into long conversations with strangers necessarily. So again, come back to what you can control, your actions. So avoiding crowded aisles, maybe waiting for people to pass by before you approach a shelf, wearing a mask, even if it's not required to in the space you're visiting. If I'm not wrong, Rachel, Blood Cancer UK has some, is it badges that people can wear that just subtly indicates that I'm still extremely vulnerable? Please keep your distance from me. This is very similar to people wearing badges now on the tube or on buses saying I'm exempt from wearing a face covering because of a health condition, which can communicate to people. I want to end this point by reminding everyone also that the human mind is very good at focusing on the bit that's the problem, that's not going right. So we can exaggerate the importance of the one person who makes an insensitive remark or doesn't understand and give it a lot more attention. Instead of that, I think it's helpful to remember that for every one individual who doesn't understand or respect your vulnerabilities, there are many people who do. So my advice would be to focus on the people who do understand and find who your community really is. And it might be that for some people, it's an online community of support like this with other blood cancer patients. But the mind can really fix on the one person who hurt you instead of focusing on all the people who are around you, supporting you and understanding that you need to go at your own pace.